Welcome back. On Monday Special tonight, we're talking about what we're terming devastating health expenditures. A sentence before we get into the discussion. Out-of-pocket health expenditures expose households to the risk of financial ruin and poverty whenever they entail significant expenditure or the sale of domestic valuables or basic family assets. We just saw that in Sylvia Chebet's story. And as I mentioned a statistic earlier on, out of 8,844 households that were sampled in a survey carried out by the University of Nairobi, 1,309 had some form of insurance cover. So where does that leave the others is what we want to ask. Our panelists tonight. On my left, we have Wandia Karago, who is a counseling psychologist. She'll tell us her story as well about initially paying out of pocket and where she is now with regard to access to healthcare. And on my right, we have the Health Principal Secretary, Dr. Nicholas Muragori, who will tell us more about solutions, way out, and what the government is doing to address this issue. Thank you both so much for joining us tonight.
Thank you.
Doctor, let me start with you and maybe just jump right into it. Why does there still seem to be such a huge issue with regards to Kenyans being able to access healthcare?
There are two components to it. One being financial barrier. The one is actually access to infrastructure. And financial barrier, the number of things we have done around insurance. So people, it's important that people get insurance. 20% of Kenya have one form of insurance or the other, and NHIF basically the biggest insurer. We have also have a number of programs that allow people to access care. Free maternity delivery programs, for example, TB, HIV treatment is free, malaria treatment is free, and so on. All that are aimed at removing the financial barrier to accessing care.
What about chronic diseases?
So chronic diseases is a new area we are getting into, and I'm glad that NHIF now has an expanded cover that covers the chronic diseases, cancers, also including hypertension, diabetes, and so on. So NHIF are now expanding its cover to cover those chronic and non-communicable diseases.
So it takes me back to the question of why we still see such a gap. Is it that Kenyans don't have the information, don't have the access? If they don't have the information, is there something being done about that? We have stories such as the gentleman we just saw in the story, and I believe what we'll hear from Wandia. Where is the gap? Where is the disconnect between the programs you're talking about and the Kenyans who don't have access to those?
I think it's more lack of information about the value of insurance, because people, all Kenyans know about Harambes. We are always being called to contribute towards the Harambes of medical care and so on. It reaches a point even your neighbor, your friends can't even, when you call them, don't even pick your call because they're being overstretched. So I think as the more and more Kenyans understand the value of having prepayment mechanism like insurance, the more you're likely to actually pay. For example, if you look at NHIF, the annual cover cost only 6,000, lowest is 6,000. So if you break down to 12 payments, that is 500. What is actually 500? Is one big fish, ngege. Is actually, if you look at a year of 6,000, probably 2 goats, 2 bags of maize, and so on. So it's something affordable. How much do women spend on a salon? One go, 1,000 shillings. That's enough for insurance. So the more people see the need of prepayment mechanism and risk of the benefit of risk pooling, the more Kenyans will actually benefit. Because if you look on average, we have 1.5 to 2 million Kenyans who sink into poverty. Not because their businesses failed, not because it never rained and therefore the farmers never really got their crops, not because the animals died, because of ill health. People go to the extent of selling everything they have, assets, that for livelihood or for promoting family welfare, and they sell everything.
So you say it's 6,000. Who has access to that 6,000? Is it every Kenyan? Is it a section of Kenyans? Who has access to that, and what does it cover you from?
So the 6,000 is the lowest. Those are usually the people who are Juakali sector, farmers, and so on. But of course, it's prorated based on your income. But what we are selling is that at the cost of 500 per month, you can get a comprehensive cover for both inpatient and outpatient. And all that you do, for example, the package for NHIF is very comprehensive. And we have rates for various hospitals, even for things like even for dialysis, it's basically for free. It's up to 10,000 shillings. For chemotherapy, they are paying up to 130,000 per session. So basically, it's free for you because you have risk pool all these resources for those who are healthy, and therefore when you fall sick, there's money to pay for your care. So what we need to have is a culture Just the way we know that for your car you must have insurance, we also need to have prepayment mechanism. So we reduce out-of-pocket expenditure.
Which is burdening so many
and driving Kenyans to poverty.
I think this is the point where we can bring in Wandia. Tell us your story, Wandia. I believe you were also at some point paying out of pocket for healthcare. Tell us a little bit about that.
Okay, previously I had been in a job and my employer paid for my health insurance, and then I left and went into self-employment. So before organizing some cover, I got the diagnosis and I needed to be on long-term treatment for a chronic illness. So I had to put money, we had to put money together as a family and friends and pay for the treatment.
Okay.
So that's, and then finally the NHIF this year said we're going to cover for chronic illnesses, and so kicked in, and it's really helped.
It's really helping. Is there a reason why at the point where you were diagnosed, you immediately sought out of pocket, we need to gather funds? Was there a part of you that said, hang on, is there a healthcare system I can access to allow me to pay for my medical cover?
Okay, I knew of, I mean, at that moment, insurance couldn't take you on because some chronic illnesses, they will not cover. So we had, of course, to get intervention done right away. So we pulled money together so that I could start on my treatment. And then this year, the last few weeks, NHIF has kicked in and it's paying.
Yeah. At what, how much did it, I would say, burden you when you were now trying to gather funds and everything? We just saw, and I keep making reference to Sylvia's story, we just saw someone who had to sell everything he had. How much did it burden you? How much did it burden your family? And what was sort of like the lowest point with regards to having to pay out of pocket?
For us, of course, at that point, because I was starting off on my own, so it means now depending wholly on my spouse and then the family. So there are many plans that have had to be on hold because finances are stretched. So that now at least we can sort of start dealing with those other things now that NHIF is.
And how did you then begin to plug into NHIF? At what point did you make that connection and say, wait a minute, I can actually go to NHIF and they can help me? Even
after leaving employment, I was still contributing to NHIF, but at that point they were not covering for chronic illnesses.
Okay, and now of course he's talking about a new program. So how is it working now? You've just mentioned that they're taking off a huge burden. Tell us a little bit about that for those who may not know how it works. The step-by-step process, how you got into the system, how they then took on your burden. How does that work?
Okay, all you do is, you have to be a registered contributor to NHIF, and then you need a form filled by the doctor who's seeing you and the facility where you go to. So NHIF form is filled, showing down the breakdown of the charges that you incur, because you have to fill that before the procedure is done. I'm on treatment for cancer, so before my chemotherapy sessions, I have to fill up that form, and then before the procedure is done, then I get clearance from NHIF so that the facility can be able to give me the therapy.
Before I go back to the doctor, what's the, may sound like an obvious question, but what's the duration of your cover with NHIF?
I don't think it's
it's sort of, it goes
as long as I keep paying.
Okay, and it's working well.
It's working well.
Okay, so that's a success story. I think I'll go back and ask, okay, so for the millions of Kenyans who are watching this thinking, how am I going to get my hands on that? Is it as simple as maybe the way Wandia has described it, the people who have chronic illnesses out of Nairobi, they may be in Embu, they may be in Kisii? How do they start the process of getting in the system with regards to chronic diseases?
First of all, the most important step is that you need to be insured before you're sick. Don't rush the insurance when you're sick. So the whole idea of prepayment is that you pay somebody little when you're healthy, so that should you fall sick, then there's enough money in the pool to take care of you. So what we want to encourage Kenyans is that when you're healthy like now, pay something. It's, the lowest is 500. You pay every month, be consistent, and then the day you fall sick, then you are covered. And then you also take care of other people who will fall sick along the way. As government, we have two strategies. We are trying to promote insurance, particularly in informal sector. All matatus, juakali, farmers, they can actually, some can afford 500 bob per month for the insurance. The other thing we have done, for those who are very poor, I know the Kenyans who cannot pay, from July, for every county, we are going to cover between 2,000 and 3,000 households per county. And that will now bring in an additional 500,000 Kenyans who will have insurance cover. And we have very progressive governors. Elgeyo Marakwet, Nyeri, Bomet, and so on, and all these have, and Kakamega as well, they have also considered insurance for their people. Makueni is coming in on board to take care of the elderly. Taita is thinking about the elderly as well. So all these ideas you can pull together. We are also challenging members of parliament using CDF to cover an additional poor people, disabled, so that all of us are then covered. So that the idea of a Harambee when you're unwell is a thing of the past.
It ceases to be a thing of the past. It begins to be a thing of the past. One or two questions from people, and they may seem simple, but someone here, Simon J, is asking, why is it that I pay 600 shillings to NHIF and I was told I can't get eye facilities, for example? Eye facilities. Is that an issue that's within the NHIF cover?
Remember there are different schemes. Some have outpatient, some have inpatient, some have civil servant scheme, they have general scheme. So each scheme you enter has the different packages. But there's something I would like to encourage you to go to the nearest NHIF office, then you know what is you entitled to as a member. But the kind of packages we have now, you cannot get it anywhere in the private sector. Of course, the private sector insurance has a role, but NHIF is progressive. We are expanding on the package. We are also making easy to interact in NHIF, either become a member or transact on when you're seeking care and so on. We are expanding the number of hospitals that are accredited, so that our members, irrespective of where you are, you can access a facility near you. So the bottom line is, the progressive Kenya we are, we would like all Kenyans to contribute towards a prepayment mechanism. NHIF is the way to go, but of course private sector insurance is also welcome. But every Kenyan with a little income, I think you can be able to contribute towards your care, so that the day you are sick, the choice of going to hospital or not should not be based whether you have money in your pocket that particular moment. You have a card and flash of that card. And for pregnant women, for example, we are now moving from what we are doing, from where we know you deliver, we pay, we're now going to give them NHIF cards. Then they have a choice to deliver whatever facility they want to.
Let me ask another question. It's been alluded to here. Again, really keeping it as simple, taking it to layman terms. Someone is asking how it works, and I think this goes deeper into how insurance works. They pay 600 or 500 shillings a month. For a year, they're in the cover, so they pay well for a year. In the second year, they have kidney failure and have to pay upwards of $1 million for dialysis. How do the two marry? How are they still assured that burden will be... Do you know what I mean? They're trying to ask how to... and I thought I'd ask that on their behalf.
Okay, now this is how it works. So prepayment, you are all pulling our money together into a pool when you are healthy. Now, NHIF has one beautiful aspect. It doesn't discriminate you. You are pregnant, you are HIV, whether you have a chronic illness, we say everybody, you're welcome on board. But we would like more and more healthy Kenyans to come to the pool. So should you fall sick, like this year I'm healthy, next year something happens, I need dialysis. Every session costs between 8 and 10,000. You're dialyzed twice. You actually need 20,000 in your pocket to stay alive. In a month is 80,000 shillings minimum. Even the most best paid Kenyan will soon run out of money. Now, but NHIF pays for that. If you develop cancer in the course of being a member, you are covered. You have a road traffic accident, you are covered. Of course, there are limits and all that, what we can pay, but the message we are telling in Kenya, we don't discriminate you on the basis of your disease. Join when you are healthy, join all of us, and then all of us, we have a big pool from which we can pay.
Okay, I have a few more questions for both before we wind up. Anderson Talaki in Voice says, this NHIF thing, is it real? With the endemic corruption in its ranks, if it were, they would be visiting patients in hospital to help. You have to follow them, and so hard it is in my case.
Okay. NHIF has gone through a lot of beating, but we must also appreciate we have made progress on governance issue. And for the first time, we'll be getting a CEO who is competitively recruited. We also look at the board membership. We automate the processes so that we remove the guesswork and potential fraud in the whole process. So NHIF undergoing reforms. We are also asking very difficult questions. Must they continue collecting the money? Can someone else buy for services? How do we control internal potential for fraud? All those reforms, we have a very clear reform agenda, because NHIF as an institution is at the center of what we call universal health coverage, which is the future that we want. And the future is now, because we want to progressively go towards where a Kenyan will never die because he not access care.
I think civic education as well, Doctor, needs to really be.
We can do more.
It needs to be done more, and maybe the example of visiting patients at hospitals to explain that to them. I think going out there, and so for you, Wandia, what would you like to tell, especially skeptical Kenyans who are thinking, no, just like the gentleman from Voice saying, I don't really trust this thing. Is it real? You know, am I going to have to really follow through with them and not even get any help? What would you like to say to skeptical Kenyans about the access that you've now gotten to NHIF?
I would like them to know that it works, because I mean, I remember the first time when they infected it, we didn't even pay a bin. We couldn't believe it because we always carried cash to pay after the session. But that day, we didn't even pay a bin. So it does work. And so far, it's going well. So he should give it a try.
All right, fine. All the best, and thank you for coming. And of course, we wish you all the best ahead. And Daktari, I think another quick question is someone is asking, how do some highly populated countries like India generally keep their healthcare costs low, yet they remain of high quality as you wind up?
Okay, we've done a lot of studies in Kenya. Look at what the average cost expenditure per person is $37. That is 6,700. Well, we are now looking at exactly what are we buying this amount, what are we buying, 6,700. There are a lot of inefficiencies in the system. Our referral system, cost of medicines, we are paying the highest in the region. We need to look at all those things so that we can be able to bring
so they need to get overhauled. All right, very quickly, Doctor. So someone right now, after watching this, they should be able to go seek out information from NHIF and get cover from them. Is that what you're saying? As many Kenyans as possible should do that now?
We want all Kenyans to come on board. For those who have an income, come on board. For those who are poor, we have started. From July, we are going to cover 500,000 Kenyans who are poor, cannot afford. And I want to challenge members of parliament to buy something. Already 6 counties are already buying insurance for their people. And even the kind of gifts we give our relatives and parents during Christmas, during holidays, buy them insurance. We have also tried to reach out to Kenyans diaspora. They're always complaining of the endless harambes they have to contribute for medical care. I'm telling them, those Kenyan diaspora, buy insurance for your relatives back home. And that's the kind of progressive society we're going to have.
We'll end it at that, and certainly be following up, especially come July. That's going to be the kind of program that's rolled out that will empower so many Kenyans. I think that would be great. Many thanks to the both of you for that. Stay with Monday Special. We'll be back shortly after this break.